It can also present with orbital cellulitis, proptosis, and vision loss. Facial paralysis is often present due to cranial nerve involvement. If the condition remains untreated, you can see ulcer with a typical black necrotic appearance. It is a clinical diagnostic point, so keep this in mind. Now next is pulmonary mucormycosis, which is the second most common form, and it occurs in patients with leukemia. Then cutaneous mucormycosis, then gastrointestinal mucormycosis, such as necrotizing enterocolitis, which is seen commonly in premature neonates. Then disseminated mucormycosis, and here brain is the most common site for dissemination. Then miscellaneous forms, which may involve any body site including bones, trachea, and kidney. So now let's discuss about the laboratory findings. Histopathological staining of tissue biopsies show broad accepted hyaline hyphae with wide angle branching. Culture on SDA at 25 degrees centigrade reveals cotton woolly colonies which are initially white and later becomes brown-black due to sporulation. It gives rise to a salt and pepper appearance. Now let's discuss about the treatment. Amphotericin B remains the drug of choice for all forms of mucormycosis except the mild localized skin lesion in immunocompetent patients, which can be removed surgically. Other antifungal used are posaconazole or isavuconazole. Often mucormycosis requires surgery to cut away the infected tissue.
Let's fight against COVID-19. Key messages to convey. First message: never forget SMS. S stands for soap or sanitizer, M stands for mask, and again S stands for social distancing. So never forget SMS. Second message is avoid 3 C's. Crowded places, close contact, and confined spaces. Avoid gathering in groups where you can't maintain 6 feet distance from others. Wear a mask or maintain 6 feet distance when you are with people you don't live with. Avoid enclosed spaces with poor ventilation. Third one is coughing and sneezing into your elbow will keep the virus off your hands, so you won't spread it to other people and make them sick too. Fourth one is some self-care tips. Keep the positive media flowing. Stay active and stretch often. Connect with loved ones. Take a coffee break. Remember to eat well and accept the help you deserve. Fifth one is how to use a pulse oximeter. Step number 1. Remove your nail polish or false nails or even mehendi and warm your hand if cold. Step number 2. Rest for at least 5 minutes before taking your measurement. Step number 3. Rest your hand on your chest at heart level and hold it still. Step number 4. Switch on the oximeter and place it on your middle or index finger. Step number 5. The reading takes time to steady. Keep the oximeter in place for at least a minute or longer if the reading is not stable. Step number 6. Record the highest result once it has not changed for 5 seconds. Step number 7. Identify each reading carefully. Step number 8. Start recording from baseline and record 3 times a day at the same times. Take extra measures if you feel change in your health. Step number 9. Call 1075 if you feel seriously ill or are unable to complete short sentences while resting due to breathlessness, or your oxygen level is 92% or less. Sixth one is how to use CoviSelf at home. 1. Each kit will be provided with all testing materials. The kit will carry a pre-filled extraction tube, a sterile nasal swab, one test card, and a biohazard bag. 2. The test is designed to be done using nasal swab to reduce the discomfort. The sterile swab kit should be inserted into both nostrils 2 to 4 centimeters until resistance is met and rolled about 5 times to make sure that adequate sample is collected. 3. The swab is then dipped into the pre-filled extraction tube and 2 full drops of the mixture should be added to the sample well of the test device. 4. The person undertaking the test will have to download the MyLab CoviSelf app on their smartphone. The app is available in Google Play Store and Apple Store. 5. The app is a comprehensive guide of the test procedure and will provide a positive or negative test result to the patient. 6. There will be 2 sections on the test card, control section and test section. 7. If the bar shows up only at the control section C, the result is negative. 8. If the bar appears on both the control section and test section, the test is positive. 9. A positive test will take about 5 to 7 minutes. A negative result will take up to 15 minutes. 10. Persons taking the rest will have to click a picture of the test strip after completing the test procedure with the same mobile phone which has been used for downloading the mobile app and registration. So remember these key messages so that we can fight against COVID-19 together.
to make a hand wash at home in simple and easy method. Let's have a look onto the ingredients. Leg soap of 50 grams, glycerin 2 tablespoons, water 1 liter. Now let's start our procedure. First we have to grind the soap like this. Now we can boil our water.